this is Argueta. I'm an endodontist from Guatemala. I have my clinical practice located in Guatemala City, and I have more than 8 years of experience in microendodontics and microrestorative dentistry. I also have the privilege of being an endodontics professor in some dental schools in Latin America. A few years ago, we were looking for a material that can offer to us bioactive properties, antimicrobial properties, and at the same time, a tight and long-lasting seal inside of the root canal system. CeraSeal have all those properties, and at the same time, the material can be applied with a very quick and easy technique. That's why we started using the material, and we still using it because we love the clinical results and we love how easy is the technique for obturating root canals. Actually, I'm one of the privileged ones that started using CeraSeal since the very beginning. I heard about the material when the company was just thinking about developing a calcium silicate-based endodontic sealers. As soon as the material was launched into the market, we started using it in our practice, and we're still using it maybe in 90% of our cases. You know, one of the questions that we receive more often is related to how many canals can be obturated with a syringe of CeraSeal. It will depend on many factors: the clinical experience, the type of canal, the type of the tooth that is being treated. But we have a very busy dental office here. We receive a lot of referrals, and we use about 2 to 3 syringes a month. So you can obturate many canals with a single syringe of this material. If I have to choose among the properties of the calcium silicate-based endodontic sealer, I will say that I like from CeraSeal his bioactivity, because the material will release calcium ions that will generate or will stimulate the formation of hard tissue. The material will release hydroxide ions that will provide the antibacterial properties. And the material will offer a tight and long-lasting sealing in the root canal system. From the clinical perspective, how easy is to apply the material and how easy is to obturate root canals with that technique. When someone asks me, should I start using these calcium silicate-based endodontic sealers, or should I keep using my current technique, my answer is always yes. You should give it a try to the calcium silicate-based endodontic sealers, because you will still having your good results, but you will be more efficient in the clinical practice. Okay, for the doctors that still not using the calcium silicate-based endodontic sealers and have not tried CeraSeal yet, my advice is go look the scientific evidence, look into the clinical technique. If the scientific evidence convinces you and the clinical technique convinces you that you are going to be more efficient, just give it a try. You will love that material because you will save a lot of time and you will have at the same time beautiful clinical results. A common question that I receive during my lectures is, when should I use CeraSeal or any calcium silicate-based endodontic sealer? And the short answer is, you can use these materials in every case. There is no specific indication for using the material. Of course, there are some complex cases in what you might combine techniques, when you might need an apical plug, for example, and you need a combination of different materials. But if we are talking about regular cases, you can use the material in every single case without any problem.